All right, let's dive right into this. Imagine you've spent the last 5 years building this massive, life-saving health network from the ground up, and now you have to hand over the keys and walk away. That is exactly the high-stakes reality we're looking at today. In this explainer, we're unpacking the anatomy of a truly crucial field visit. We're talking about the joint monitoring mission by the Korea Foundation for International Healthcare, or KOFIH, and Uganda's Ministry of Health. It is a really fascinating behind-the-scenes look at how complex global health interventions actually wrap up, and more importantly, how they prepare to hand power back to the local community.
Here's our roadmap for today. We're starting with a 5-year health mission, then moving into the goals of the monitoring visit, checking out their strategic 2-day schedule, and finally, looking at securing the project's legacy.
Okay, Part 1, the 5-year health mission, building capacity in Uganda's south-central region. So, for years, KOFIH and Uganda's Ministry of Health have been pouring resources into strengthening community health systems in the Bukaman-Simbi and Masaka districts. But the absolute critical factor here, it's the number 5. This capacity-building project is entering its 5th and final year. The clock is literally ticking. This joint monitoring exercise isn't just some routine check-in. It's a major part of an overarching framework to assess implementation, review everything they've achieved, and provide technical guidance before time runs out. They have to figure out the exact impact they've made before wrapping up operations.
Now, you might be wondering, who exactly are they building this capacity for? Well, it all comes down to the VHTs, or Village Health Teams. As we define them here, VHTs are the frontline community health workers. They are absolutely vital because they bridge that critical gap between local communities and facility-based healthcare services. This entire 5-year project was specifically designed to empower these frontline heroes, to improve how they deliver community health services, enhance the reporting systems, and just better coordinate their work with the actual health facilities.
Moving right along to Section 2, Goals of the Monitoring Visit. We're assessing progress alongside the Operational Task Force, which includes Waswa Erisa, Simon, Sharifa Napokande, and Dr. Raymond Twiheo.
So what's the core of their entire mission? It's all about securing sustainability plans for community health service delivery after project closure. This means actively engaging district leadership, facility in-charges, and the VHTs themselves. Because think about it, all that funding and training, it means absolutely nothing if the system just collapses the day the project ends. They must ensure these health services thrive long after KOFIH closes its doors. That's exactly why this visit matters so much. It's about survival after the safety net is gone.
Of course, wrapping up a massive 5-year project? Yeah, that means tying up a lot of administrative loose ends. The team has several crucial secondary mission objectives, too. First, they need to follow up on action points from previous Project Management Committee, or PMC, meetings. They also have to update local stakeholders and implementing partners on an upcoming community health worker satisfaction survey and the project's end-line evaluation. Basically, they're securing everyone's cooperation for the final grading of the project. And, very importantly, they absolutely must prepare for the physical distribution and handover of project equipment and materials directly to the VHTs over in Masaka District.
All right, Section 3, a strategic 2-day schedule. Deploying the task force.
To pull this off on June 22nd and 23rd, the task force has to do this really delicate balancing act. On one side, we have the top-down leadership, the mayor, the town clerk, the chief administrative officer, the district health officer, and the LCV chairperson. These are the politicians and administrators whose buy-in is absolutely essential for the project's long-term survival. Then, on the other side, you've got ground-level operations, the facility in-charges, the village health teams, and the actual health workers. The monitoring officials have to expertly manage both ends of the spectrum. They're essentially translating top-level policy directly into ground-level reality.
Let's actually look at how that plays out on the clock. The morning of day 2 is, honestly, it's a relentlessly packed back-to-back diplomatic push. They start right at 8 a.m. with the city health officer in Masaka City to hammer out Year 5 activities. By 10 a.m., they're over in the mayor's garden briefing the mayor on achievements. Come 11 a.m., they have a courtesy interaction with the town clerk about coordination and sustainability. Then, right after a quick lunch break, it's straight into a massive 1 p.m. review meeting with the CAO, the LCV chairperson, and the district health teams at the Masaka District Local Government to follow up on those PMC action points. It is just an absolute whirlwind of administration.
But hey, diplomacy is really only half the battle, right? By the afternoon, these officials transition straight into the ground game. At 2 p.m. on day 2, they finally leave the offices and head out for a field visit at Bukakata Health Center IV so they can directly engage the health workers and VHTs. The next morning, day 3, kicks off at 9 a.m. with the Bukoman Sinbi district leadership. Then from 10:30 a.m. to 1 p.m., they are back out in the field. They're monitoring project-supported interventions and assessing progress at Kigangazi Health Center 3, Bigaza Health Center 3, and the Bukomen and Sinbi district headquarters. They physically trace the project from the absolute highest administrative offices right down to the rural health clinics.
Which brings us to Section 4, securing the project's legacy, the expected outcomes.
So, what does all of this running around actually achieve? Well, the source material outlines very concrete deliverables that the monitoring officials absolutely must secure before they leave. First up, they need to generate a comprehensive monitoring report filled with key findings and recommendations. Second, they have to finalize the agreed-upon plans for the end-line evaluation activities and the physical handover of the project's assets to the community. And third, they must permanently document the lessons learned and best practices. This guarantees that the successes and operational lessons of the last 5 years aren't just lost to time, but can actually be utilized in future global health initiatives.
But, the most important expected outcome of all? It's right here. Strengthen stakeholder commitment to project sustainability and closure activities. Because at the end of the day, officials can write all the reports and schedule all the asset handovers they want, but the true success of this entire 5-year endeavor relies entirely on the long-term commitment of the local partners. The local government and the community themselves really have to take ownership. They have to want to keep this going.
Which leaves us with a really powerful question to chew on. When a massive, internationally funded project finally ends, how does a community keep its health systems thriving? This KOFIH and Ministry of Health joint monitoring visit isn't just about checking boxes on an itinerary. It's about answering that exact question for the people of Bukoman Sinbi and Masaka. It's about ensuring that those frontline village health teams remain empowered to keep saving lives long after the official mission is complete. This really gives you a totally new perspective on the complex, on-the-ground realities of global health, doesn't it? Something to think about until next time.